Hey, what's up, guys? In this video, we're going to ask some general medical terminology and questions to the general population and see what they know about different medical conditions. So, my first guest is my mom. Okay,
Hi.
so what is your understanding about the term osteoarthritis?
Osteoarthritis. I've heard it a number of times. Is it something to do with bones?
Yeah, what do you know about it?
It's some inflammation of the bones.
Okay,
Uh,
that's about it.
that's
Okay, so there's a common term that's often used, and that's called slip disc. So, what is your understanding about slip disc?
it's with your spine. Some of your vertebrae have slipped. So maybe something like prolapse.
And what does it do?
It gives you acute backache,
Okay.
and you have problems sitting, standing, lying down.
Common condition we hear about a lot is sciatica. So, what's your understanding about sciatica?
Sciatica, I've heard a number of times. It's like running pain in one of your leg. It's, I think, something to do with your back, some bone, which kinds of, there's an inflammation or some sort of this, and there's this shooting pain which happens.
Up next is varicose veins.
Yes. So it's when the blood supplies is restricted to your lower extremities, probably it causes your veins to bulge out, and then there's this acute tiredness, and you feel all sorts of, and there are these blue spider veins coming out and showing, and so
Okay.
that's
Any pain in that?
there's fatigue, and fatigue in the legs, and then I believe if you raise your legs and sit and the blood flows back, then it gets better.
Okay. So, what is the difference between osteoarthritis and rheumatoid arthritis?
Osteo, it's to be not too sure. Joints, osteo is your knees or joints, and rheumatoid is where your smaller joints are affected. Maybe osteo is where your larger joints are affected.
All right, mom. What is a stroke?
Stroke, something to do with the heart, brain. No, brain. I think when the supply to your brain vessels is kind of restricted, it causes some kind of obstruction, and then you have a kind of maybe a paralytic attack for a while, and at times a distorted face, and then when the clot dissipates, then you're back to with medication, maybe normal. I
Okay.
think that's, as a layman.
Last one. What's a tennis elbow?
Elbow
Yeah.
becomes like a tennis ball. when, when there's some pain in the elbow, probably out of twist, overuse of your arm, it causes some kind of pain
In the elbow?
in the elbow.
Okay.
And that's what I can think of, and probably maybe a tennis ball comes.
Okay, so we have another new candidate for questioning, and this time it's going to be my dad.
Hello.
Okay, Dad, what is a golfer's elbow?
Golfers. I've heard of tennis elbow. Golfers is something new. Are the two things connected? And if so, I think it's a pain which one experiences when you force hit with the racket or with the golf set. That muscular pain or the joint pain is called the tennis elbow or the golfer's elbow.
Where does the pain happen generally? What do you think would be the answer?
It is the joint part and adjoining muscles.
Next question. What is a frozen shoulder?
Frozen shoulder is, I think, when particular muscles in the shoulder region which are not exercised or not used properly and all that, and they go weak, the person feels a pain or inability to raise the hand up or do certain functions in that region.
Okay. So pain and
Pain and discomfort.
so what is a muscle spasm?
Muscle spasm is, I don't know the reason for it, but when the muscles contract, maybe in reaction to certain pain or trauma and all that, so they contract, and that further leads to stoppages of blood, and that further aggravates the problem.
And what is the problem?
Problem, again, like I told you, I'm not really sure of why. It happens because of the trauma, or really, or
No, but what is the pain? What is the problem? Pain, discomfort?
yeah, pain. One feels pain and unable to carry out that particular.
What is carpal tunnel?
Well, this I wouldn't know.
Okay. What is spondylitis?
Spondylitis is a pain, I think, in the backbone region, maybe in the upper part of the backbone or the lower part of the backbone. Could be connected to the posture or some injury or something. That is what I
What
know.
is shoulder impingement?
No idea, absolutely.
What is a bunion?
Bunion. Again, no idea whatsoever.
Okay, perfect.